gas-filled drops of liquid blow everywhere when a sneeze or cough isn't covered. Just how far those drops can blow was not known until now. I'm Erin White with your latest health news. Coughs and sneezes spread respiratory diseases from infected people to people who are susceptible to the germs. To help understand the spread of germs by sneezes and coughs, a research team from MIT found that coughs and sneezes actually produced clouds of droplets that stayed airborne long enough to reach ceiling ventilation units. A report on the research stated that this could mean that ventilation systems may be more likely to transmit potentially infectious particles than had once been thought. Sneeze or cough into a disposable tissue, then wash hands thoroughly to help protect yourself from disease.
More women are choosing an aggressive treatment option for a diagnosis of breast cancer, and this trend is rising fastest in a certain group of women. I'm Shelby Cullinan with your latest health news. To track trends in treatment of early-stage breast cancer, a research team reviewed a large database of information to find which type of surgery women chose as their treatment. The results show that when cancer was found in one breast, more young women than in previous years were choosing to have both breasts removed. The authors of the study wrote that the chance of getting cancer in the other breast was only 3% in 5 years and 6% in 10 years. They also explained that these rates have been dropping due to the development of more effective treatments. Ask your oncologist about breast cancer treatment options.
Older adults now have another reason to add gardening or a leisurely evening walk into their daily routines. This activity may be good for their hearts. I'm Erin White with your latest health news. Recently, researchers looked at the connection between leisure time physical activity and cardiac well-being in older adults. They found that older adults who spent more time being active had more regular heartbeats than those who were less active. Additionally, older adults who increased their walking distance or pace had better heart rate variability than those who decreased the amount and pace at which they walked. Continue with safe physical activity as you age.
Allergies is an immune system disorder that occurs when the immune system is overly sensitive to certain non-disease-causing substances called allergens. Allergies can be described as a false alarm of the immune system. Allergies can cause a variety of minor symptoms, including runny nose, itching, swelling, or sneezing. However, some severe allergies can cause hives, trigger asthma attacks, or create life-threatening breathing problems. Some common allergens include pollen, pet dander, insect stings, certain food, and certain medication. Family history of allergies, a lack of early childhood exposure to allergens, and young age may increase the risk of developing allergies. Treatments include many over-the-counter antihistamines, including cetirizine, fexofenadine, and loratadine. Prescription steroids, including prednisone and methylprednisolone, have also been used to treat severe allergies. Allergy shots, also known as desensitization therapy, is often effective at preventing allergies. The easiest way to prevent allergies is to simply avoid the offending allergen. Wash hands and clothes thoroughly after touching a known allergen. Know and avoid drug and food allergies and exercise caution whenever there is a chance you may be exposed to serious allergy triggers.
You expect food to nourish you, not to make you ill, but foodborne illness remains a problem in the U.S., as a new study has shown. I'm Shelby Cullinan with your latest health news. This new study from the CDC looked at preliminary data for 2013 to examine trends in these illnesses during the last year. Salmonella infections, the most common type of foodborne illness, is often transmitted through foods with an animal origin, like meat, milk, or eggs, but any food can become contaminated with bacteria. Whereas Vibrio bacteria are usually transmitted through raw or uncooked seafood. The study found that rates of foodborne illness in the U.S. largely stayed stable in 2013. But while salmonella infections decreased, illnesses caused by the bacteria Vibrio saw a big jump. Make sure your food is cooked and cleaned thoroughly before eating.
Prescription medications are familiar to many people in the United States, but just how common are they and which types of medication are we mainly using? I'm Sonia Singh with your latest health news. A new report by the Centers of Disease Control and Prevention, or CDC, analyzed the use of prescription meds in the U.S. The report showed that during 2007 to 2010, almost half of Americans had used a prescription medication in the past month, and many of these Americans were using said medications for heart-related issues and cholesterol levels. Speak with your doctor to learn more about the appropriate use of prescription medications.
Physical activity and exercise are typically recommended as part of a healthy lifestyle. Yet for some, there may be such thing as too much exercise. I'm Kendra Rowland with your latest health news. Recent studies looked at the relationship between exercise and heart health. Researchers tracked the physical activity habits of patients with heart disease. They found that patients who exercised moderately had the lowest rates of stroke and heart attack compared to inactive and very active patients. Another study found that in men, vigorous exercise at age 30, followed by sedentary habits by age 60, was tied to increased risk of irregular heartbeat. Work with your doctor to find a healthy fitness plan.
Vaccines are designed to protect against disease, but babies cannot get most vaccines until they're 2 months old, leaving them vulnerable. A vaccine during pregnancy may help. I'm Shelby Cullinan with your latest health news. A recent study found that giving mothers a vaccine against whooping cough during pregnancy increased their baby's protection against the disease after birth. The vaccine is called Tdap, which stands for tetanus, diphtheria, and acellular pertussis. The newborns whose mothers received the Tdap during pregnancy had more antibodies against whooping cough than the babies of mothers who received the Tdap after giving birth. Ask your OBGYN about the Tdap vaccine during pregnancy.
Childhood obesity has gotten plenty of attention, but are behaviors that may prevent it really changing? I'm Erin White with your latest health news. A new report explored the state of physical activity among U.S. youth. According to the National Physical Activity Plan Alliance, the U.S. 2008 Physical Activity Guidelines recommend that children between the ages of 6 and 15 get at least 60 minutes of moderate to vigorous physical activity 5 days of the week. However, the report found that overall, only around a quarter of these children are meeting this recommendation. The report also estimated that on average, U.S. children spend more than 7 hours a day on sedentary activities, a number that increases as they get older. Speak with a pediatrician about your child's level of physical activity.
Poor diet can contribute to the risk of developing type 2 diabetes, but which is the right diet to reduce that risk? I'm Shelby Cullinan with your latest health news. People with type 2 diabetes have high blood sugar because their bodies do not use insulin effectively to reduce the blood sugar levels. Results of a recent study have shown that several healthy diets, including the DASH and Mediterranean diets, can reduce the risk of developing type 2 diabetes. These diets emphasize vegetables, fruits, whole grains, beans, seeds, nuts, and healthy fats, as well as certain types of lean meats, fish, and low-fat dairy products. Ask your doctor how to cut your diabetes risk.
Kids who don't get enough sleep might drive their parents crazy sometimes, but there could be more at stake. Kids' waistlines could suffer too. I'm Mindy Cook with your latest health news. A recent study found that children getting the least amount of sleep through early childhood were most likely to be obese. From infancy through age 7, children getting too little sleep had larger hip and waist measurements and greater fat mass. Be sure your child is getting enough sleep at night.
For many, using aspirin can be a huge help when it comes to fending off a headache and reducing the risk of a heart attack. However, could aspirin also help lower the risk of a certain type of cancer? I'm Sonia Singh with your latest health news. A new study funded in part by the National Cancer Institute has found that people who carry a particular gene may reduce their risk of colorectal cancer by taking aspirin. The study focused on over 200 colon cancer cases that developed over the course of 3 decades. Although research is ongoing, researchers concluded that doctors could safely take a biopsy from the colon during a colonoscopy to determine which individuals would benefit from a daily low-dose aspirin regimen. Speak with your doctor to learn more about the benefits of aspirin.
Lice are parasitic insects that can sometimes be found on the heads and bodies of certain patients. Lice can cause intense itching and small red bumps on the scalp, neck, and shoulders. In addition, lice eggs or crawling lice may be visible in the hair or on the skin. There are 3 common forms of lice, including head lice, body lice, and pubic lice, sometimes known as crabs. Lice are easily spread through close personal contact and by sharing belongings with people who have lice. Even though lice most typically affect school children, lice can affect people of all ages. Lice are not spread by pets, nor can they hop or fly to new hosts. Both over-the-counter and prescription medications are available to treat cases of lice. Over-the-counter medications like Nix and Rid are available as shampoos, lotions, and rinses. Prescription medication, including Sklice, is available as well for cases that are hard to treat. Keep people with lice away from others until they can be properly treated. Maintain proper hygiene to avoid lice. Always remember to wash all clothes and bed sheets with hot water and detergent if you find someone close to you has had lice, as lice can sometimes survive on household items for long periods of time.
Untreated appendicitis can have serious consequences, but surgery may not be the only option for children with the condition. I'm Erin White with your latest health news. Appendicitis occurs when the appendix becomes inflamed or infected, swollen, and painful. Researchers found that appendicitis was successfully treated with antibiotics in almost all of the children who were treated with them. This treatment meant kids could return to school sooner and felt better than the children whose appendicitis was treated with surgery. Speak with a doctor about the risks and benefits of different treatment options.
Many people drink caffeinated drinks like coffee or tea on a daily basis. It's possible that even small changes in coffee consumption could affect their health in a major way. I'm Shelby Cullinan with your latest health news. A recent study found that people who increased their coffee consumption by more than 1 cup per day over a 4-year period were 11% less likely to develop type 2 diabetes in the following 4-year period compared to people who did not change their average coffee consumption. The findings reveal that these increases and decreases in type 2 diabetes risk were only associated with caffeinated coffee. Discuss your daily coffee consumption with a doctor. By translating health information into a consistent, easy-to-understand language, the DailyRx News Network enables you to take control of your health. Sign up for the DailyRx newsletter to receive the latest health news and videos right to your inbox every morning. For trusted, research-based health news, join us at dailyrx.com. Your health starts here.
For those with chronic high blood pressure, keeping healthy is essential. Exercising and maintaining a healthy diet can delay or prevent diabetes. These interventions can even save lives. I'm Sonia Singh with your latest health news. Prediabetes is constantly high blood sugar that isn't quite high enough to qualify as diabetes. A study was conducted with patients who have this condition, some of which were assigned to a diet or exercise intervention, while others received standard medical treatment. Following up 20 years later, the intervention group had significantly lower rates of death from all causes and from heart disease, as well as lower rates of diabetes. Speak to your doctor about diabetes prevention and treatment.
Osteoarthritis is the most common form of arthritis that results from a breakdown of cartilage around the joints. Healthy cartilage usually absorbs the shock of movement and activity, but when cartilage is lost, the bones are able to grind against each other. This can occur in any joint, but usually occurs in the hands, knees, hips, or spine. As osteoarthritis worsens, it can cause pain, swelling, and reduced motion in the joints. Over time, osteoarthritis can cause permanent damage to the bone and even make walking and other daily activities difficult. Osteoarthritis usually happens gradually over time. Some risk factors that might lead to osteoarthritis: being overweight, getting older, joint injury, joints that are not properly formed, a genetic defect in joint cartilage, stresses on the joints from certain jobs and playing sports. Osteoarthritis occurs most often in older people. Younger people sometimes get osteoarthritis primarily from joint injuries. Doctors often combine treatments to fit a patient's needs, lifestyle, and health. Treatment may include exercise, weight control, rest and joint care, non-drug pain relief techniques to control pain, and even surgery. Medications include acetaminophen and NSAIDs such as ibuprofen. Lifestyle changes, including weight loss, gentle exercise, and hot and cold packs, can help reduce pain and sometimes slow down the progress of osteoarthritis. Some supplements containing glucosamine and chondroitin may also help with joint health.
While it may seem like a harmless activity, spending countless hours in front of the television could be negatively influencing your children. I'm Shelby Cullinan with your latest health news. A recent study found that when parents watch 2 or more hours of television a day, their children were more likely to follow suit compared to others. According to the American Academy of Pediatrics, children should watch no more than 2 hours of television per day. Since parents' screen viewing time was found to be connected to their children's, the authors suggested that parents should change their viewing habits. The study authors concluded that screen viewing habits can persist throughout adulthood, so establishing healthy habits in childhood is very important. Limit the time you watch television.
While it's true that childhood obesity is a complex problem influenced by many factors, the key to combating this problem may lie in 3 simple rules of thumb. I'm Erin White with your latest health news. A recently published paper cited the 3 rules as eating a mostly plant-based food diet, being more active, and turning off media. It concluded that by replacing noise, processed foods, and physical inactivity with silence, minimally processed foods, and physical activity, parents and children can lead healthier lives. Make sure to eat healthy, get moving, and limit your family's media intake.
A woman experiences a variety of changes to her body while she's pregnant. While these are normal changes, they might influence her alertness or the way she's feeling occasionally. I'm Shelby Cullinan with your latest health news. If any person is feeling tired, nauseated, or otherwise not well, it may increase their risk of an accident while driving. A recent study found that pregnant women who may feel fatigue or nausea more often than usual had a higher risk of a car accident while driving in their 2nd trimester compared to their risk while not pregnant. Be alert and follow traffic laws while driving.
When it comes to medical testing, a person's weight can affect the accuracy of the test results. A recent study looked at whether or not weight affects the test results when testing women to determine if breast cancer has spread. I'm Kendra Rowland with your latest health news. This study looked at whether ultrasounds could effectively detect breast cancer in obese women's underarm lymph nodes. Researchers found that ultrasounds were just as effective at looking for breast cancer in overweight or obese women as in women with a normal weight. Additionally, ultrasounds were more accurate among overweight and obese women when it came to negative findings, determining that there was no cancer. Speak with your doctor about breast cancer screening.
Here's another reason to make whole grains and vegetables a part of your diet. Getting enough dietary fiber may be a life-changing health decision for people who've had a heart attack. I'm Erin White with your latest health news. Fiber is commonly found in vegetables, fruits, beans, legumes, and whole grains. Recent research looked at the link between dietary fiber consumption and death in people who had previously had a heart attack. The researchers found that participants who ate the most fiber had better survival odds than those who ate the least. They noted that dietary fiber from cereals provided the strongest protection against death. Get your daily recommended amount of dietary fiber.
Most parents try to start their children's day with a healthy breakfast, yet one of the most popular breakfast foods is often packed full of sugar. I'm Valerie Cavett with your latest health news. Experts claim that a typical breakfast cereal is loaded with added sugar. They have calculated that people who eat one bowl of typical breakfast cereal every day would eat 10 pounds of sugar in a year. Study authors noted that sugar has been shown to contribute to health issues such as tooth decay and cardiovascular disease. Read all food labels to ensure that your family is eating well.
Consuming lots of sugary drinks can expand your waistline, but you may not be aware of what it also might do to your blood pressure. I'm Erin White with your latest health news. Sugar is added to many food products, but the largest source of added sugar we consume is in sugar-sweetened drinks. Drinking sugar-sweetened beverages has been linked to obesity, high blood sugar, heart disease, and kidney stones. Recently published research found it was also associated with increased blood pressure and a greater risk for developing hypertension. The studies that researchers analyzed showed a 26 to 70% increased risk of developing high blood pressure in people who consumed sugar-sweetened beverages compared to people who did not drink sugar-sweetened beverages. Speak with a doctor about healthy blood pressure levels and limit your consumption of sugar-sweetened beverages.
Psoriatic arthritis is a joint problem that often occurs with psoriasis, an immune system disorder that causes red, itching skin. Psoriatic arthritis occurs when the immune system begins to attack healthy cells in and around the joints. Psoriatic arthritis causes pain, stiffness, and swelling of the joints, and can often cause significant fatigue that does not go away with rest. Psoriatic arthritis is usually mild, but some serious cases can affect and even damage multiple joints. In patients with psoriasis, age and family history may increase the risk of psoriatic arthritis. There is no cure for psoriatic arthritis, but certain medications can help control inflammation, pain, and damage to joints. Non-steroidal anti-inflammatory drugs, otherwise known as NSAIDs, corticosteroid injections, and methotrexate are often effective in relieving symptoms. Treatment may also include physical therapy and gentle low-intensity exercise. In some cases, surgery may be needed to repair or replace damaged joints. Managing psoriatic arthritis can become a lifelong challenge. Certain lifestyle choices include a healthy weight and physical activity. These seem to reduce symptoms. Cold and hot packs and proper fitting footwear can also make a difference for some patients. Drinking alcohol or smoking has been shown to increase the risk for esophageal cancer, and enjoying the two vices together might raise that cancer risk even further. I'm Shelby Cullinan with your latest health news. Esophageal cancer is cancer of the tube that carries food and drink to the stomach. While the combined effect of drinking alcohol and smoking increased the chance of developing esophageal cancer, researchers reported that when the two habits were taken together, the cancer risk was greater than having either habit on its own. The researchers recommended that the intake of alcohol and the use of tobacco be reduced as much as possible. Tell your doctor if you drink alcohol or smoke.
COPD causes difficult breathing, which can lead to anxiety and insomnia. A new study says a common type of medication used to ease these symptoms may not be the best option for those with COPD. I'm Erin White with your latest health news. This new study showed a significant increase in the risk of COPD patients having a severe respiratory event, such as shortness of breath or fits of coughing, when prescribed a benzodiazepine medication. Study data showed that COPD patients who used benzodiazepines were 45% more likely to experience respiratory-related side effects than the group not taking benzodiazepines, as well as 92% more likely than the benzodiazepine-free group to require emergency room treatment caused by increased severity of their COPD symptoms or the development of pneumonia. Speak with the doctor about your COPD symptoms and medication that is safe and effective for your condition.
Diabetes is a condition where blood sugar levels remain higher than normal. There are two main types of diabetes. In type 1 diabetes, the body attacks cells that normally produce insulin. In type 2 diabetes, the body does not make or use insulin the way it should. Insulin is a hormone that helps the body use sugar for energy. In diabetes, problems with insulin causes sugar to stay in the blood. Another form of diabetes that mainly affects pregnant women is known as gestational diabetes. Symptoms of diabetes include increased thirst, frequent urination, fatigue, blurred vision, frequent infections. Age, family history, race, diet, and lack of exercise may increase the risk of developing diabetes. Over time, having too much glucose in the blood can cause damage to the eyes, kidneys, and nerves. Diabetes is also a risk factor for many other conditions, including infection, heart disease, and liver problems. There are many different medications that can help treat diabetes. Oral anti-diabetic medications like metformin and glipizide are effective in keeping blood sugars in check, and injectable insulins are often used to help the body use blood sugars normally again. Eating a healthy diet, maintaining a healthy weight, and exercising can help control diabetes. It's important for diabetics to routinely check their blood sugars, take medications on time, and get regular checkups to watch out for complications.
The risks of smoking can extend beyond your own health and that of the individuals breathing the secondhand smoke. They may extend to your children's choices as well. I'm Shelby Cullinan with your latest health news. A recent study found that teens were increasingly more likely to smoke with each extra year their parents smoked since the kids were born. Even if the teens were not regular smokers, they were more likely to experiment early on with smoking for each additional year their parents lit up. Quit smoking before having kids.
All people who have diabetes are also at risk for heart disease, but one gender may face a higher risk than the other. I'm Mindy Cook with your latest health news. A recent study found that women with type 2 diabetes had higher systolic blood pressures and higher LDL, or bad cholesterol levels, than men. Both high blood pressure and high LDL cholesterol are risk factors for heart disease. The risk of death from cardiovascular disease is 2 to 4 times higher among people with diabetes. If you have diabetes, discuss your heart health with a cardiologist.
E-cigarettes have become a popular fad among smokers and have often been used as a substitute for regular cigarettes. Yet the debate surrounding them has grown, and now rules governing the products may become stricter. I'm Kendra Rowland with your latest health news. The FDA has proposed that e-cigarettes and other tobacco products would fall under their regulation. The FDA currently regulates certain tobacco products, including cigarettes, roll-your-own tobacco, and smokeless tobacco, but not others. The proposed change would extend this regulatory authority to include additional products. The rules would require e-cigarettes to include health warnings and only make health claims confirmed by the FDA. Speak with your doctor about healthy ways to quit smoking.
Celiac disease is not common among children, but it may have been underdiagnosed until recent years. Knowing risk factors for it may help parents. I'm Shelby Cullinan with your latest health news. A recent study was conducted of nearly 1,000 children in Italy who were assessed for stomach problems. The children were classified as having either irritable bowel syndrome, abdominal pain, or upset stomach indigestion. The study found that children with irritable bowel syndrome are 4 times more likely to have celiac disease than children without irritable bowel syndrome. These findings mean that parents of children with irritable bowel syndrome may want to ask about screening for celiac disease. Ask your pediatrician about celiac disease screening.